Welcome back to TMI Talk with Dr. Mary. I'm your host, Dr. Mary. I've brought on Dr. Laura Currens. She's an orthopedic and pelvic floor physical therapist and owner of Dynamic Flow Physical Therapy in Ventura, California. And as you can see, we're in a bit of a different space. We did a business retreat here in Taos, New Mexico, which we highly
recommend.
I don't have my normal setup. I just had one little mic, so we put it here on the couch. But super excited about this episode because Laura and I have had very, very similar journeys of first, she's a breast cancer survivor. She found out she had breast cancer at 35. I had Hodgkin's lymphoma at 33. So going through our journeys of that, explaining what happened with us, and then how you can support your family members or friends when they're going through cancer treatment. Because there's a lot of things that, little details like asking them, can I sit with you during your chemotherapy? Or can I come over and do laundry instead of asking what can I do? Because it kind of adds to the mental load. Then we dive in a bit to relationship changes, like Laura's marriage got stronger. Mine, I ended up getting divorced, and how we can help support marriages or relationships during cancer treatment, because I don't believe we were given tools to be able to navigate that. And it can be a lot on the partners. It can be a lot on family members and how we can, help support people in that way. And then we dove into what happens after cancer treatment. Like you're just all of a sudden pushed into life again and acting like things are normal. And then over time, Laura and I noticed that we were in early phases of perimenopause. And so we dive into, things that we have found that helped us, and also what we can help with from a physical therapy perspective. Because there's a lot that we can do beyond HRT. I know we're in a big movement right now of HRT. It solves everything, but it really doesn't for a good amount of people. It can help a lot of people drastically. It can help people some, and then some people can't tolerate it, or it's contraindicated, or they don't want to. And so we dive into some different ways that physical therapy can help. And so we're really excited for you to listen to this episode. If you want to.
Awesome. Thanks so much for having me. And
Yay.
Excited to be here.
Yeah, we're excited for you to listen to this. So thank you. Welcome back to TMI Talk with Dr. Mary, where we dive into non-traditional forms of health that were once labeled as taboo or dismissed as woo. I'm your host, Dr. Mary Grimberg. I'm an orthopedic and pelvic floor physical therapist who helps people navigate perimenopause by addressing the fascia, lymphatic system, musculoskeletal system, viscera, and the nervous system. My whole body approach goes beyond hormone replacement therapy, showing how movement and rehab professionals can play a much bigger role in this process. And now we'll start our next episode. All right. So, you and I have been on this similar journey of going through cancer treatment and then going into early perimenopause. So if you want to share your cancer journey and a little bit about your experience, so people can kind of get to know you.
Awesome. Thanks so much for having me.
Of course.
So I was diagnosed with breast cancer at 35. I was 10 months postpartum with my second child. So obviously a little shocking. I was picking up my vomiting kids from daycare and got the call saying, you have cancer, which is just not what you're expecting at 35. And then I'm sure you had a similar experience, but you just kind of fall in every tiny little category. It's like, well, it's just microinvasion. It's just precancer, DCIS. And then it's like, okay, well, actually there's some invasive cancer. Oh, it's a very aggressive type of cancer. So it's funny how it just kind of keeps adding and adding and adding up. But yeah, that's kind of my start. And then that led to surgeries and chemo and an injection that I did for 18 sessions. So a little over, I guess it was 15 months.
Yeah, we'll kind of jump into that a little bit about, so when did you did you notice, first of all, you had breast cancer, so people can, that's what you had, but let's dive in a little bit about did you feel a lump, or how did you know, right? Because you were saying previously that it wasn't detected except through ultrasound. So
yeah, I love to share this part because I think it's so important for pregnant and postpartum moms.
Yeah.
I had a clogged milk duct, and it was super tiny, tiny, tiny little dinky thing by my nipple. And you would never even have thought anything of it, to be honest, I think the average person. But I noticed my milk was coming out slower. I was an overproducer. I was donating breast milk. I was pumping at work, and I was like, gosh, this is taking so long. And I had this deep itch. I've seen a lot of cancer survivors discuss this, but it was this deep, deep itch, kind of on my boob. And I thought it was wintertime. I was like, oh, it's probably just a little dry skin. But it was like a deep, almost like nerve itch. And the clogged duct was not clearing. So I probably had it for like 6 weeks, maybe going into 8 weeks. And I was like, oh, it's so weird. It's just not going away. And I had this intuition of myself. I was like, I'm going to make a doctor's appointment and I'm going to just demand an ultrasound. Like, I don't know why in my head I was like, I need an ultrasound. And I went to my appointment. She was like, well, it's just a clogged duct. Do the classic things to get rid of it. And I was like, no, I really want an ultrasound. I just give me an ultrasound. And I respect her still to this day because she honored my wishes and gave me the ultrasound, which is what started the whole process.
Yeah, I mean, I think and I'll kind of jump into mine, is I had just noticed a lump above my right collarbone, and had been going on, same thing, about like 12 weeks or so, and had to go into my doctor, and mine wasn't as responsive as yours. She was saying, oh, just take antibiotics, we'll get some imaging, and we got imaging, a CT scan, and it was missed. They missed a golf ball sized tumor. And it was interesting because I think it's important we talk about that intuition, right? So one day I kept going back to this one doctor, and it was just like, we weren't even biopsying it, and when you can Google lymphoma, and like the first symptom is, a tumor above your collarbone. And so I think it's important that we advocate, because if I didn't advocate, I switched doctors because I wouldn't get a biopsy, got the biopsy, then kind of found out too, through a phone call. You're just like, you're on your day.
Yeah.
And for me, I got the phone call and I was like, oh, I thought it was a physician calling me about one of our patients.
Oh my gosh.
And then it was, oh,
you have cancer.
You have cancer.
Yeah.
And you're like, oh shit.
Yeah.
It's like that moment of, what was it like for you when you found out you had it?
Well, I was already, like I said, I'm so grateful in a sense that I had left work, because I was actually working, and I got a call from daycare saying my kids were throwing up. So I had to go pick them up. So I left work, and I'd literally just get in my kids in their car seats, because they were, 10 months and just under 3, so 2. And I was just buckling them up, and I get this call, and same thing. I see, a doctor's office calling, and you're like, okay, let me answer this. And like I said, they're vomiting, and it was just messy. And it's like, you have cancer, or whatever. It came back, whatever. And it's just like, wow, like, I don't even think I had time to process it, because I was trying to get my kids home, and then I had to take care of them. So I don't even think I really got to process it, honestly, for a few days. But then you jump into like action, right? You're like, let me make an appointment. Let me get into on-call. I mean, it turns into this whole whirlwind.
Oh my God, the whirlwind. Yeah.
It's so overwhelming.
Totally. And like for me, when I had found out, I remember I was at work, I had a patient coming in like 10 minutes, and I had just started my business. I was a year in, and I was like, I remember looking out the window and going, no. Like, it was my birthday too, actually. I was like, oh, great. Like, what a birthday gift, And it was one of those moments where you're just like, no way. Like, I don't have cancer. Like, cancer's for other people. It's not for me. I know that sounds weird.
No, I
It's
get
like,
that. Yeah.
it's one of those things you just hear and you're like, oh, that's somebody else's story. But when it becomes your own story, it is just such a gut-wrenching call that you don't ever want to get. And then you're a part of this club that you never want to be a part of. And like, for me, it was not finding out I had cancer, is, am I dying? Like, because finding out you have cancer and then finding out you're terminal are two different things. So I don't know if you had.
Oh, I went through all sorts of emotion. I mean, I'm like, I'm going to leave my kids. They're not going to have a mom. I mean, I was already postpartum, so you're already, kind of going through hormones and such. But yeah, I mean, my husband's going to raise my kids by himself. Yeah. Like, do you you just don't know what to expect. And then when everyone's like, you're so strong.
I can't.
You're going to get this. You got this. You're going to be okay. It just was irritating me so much. I was like, you do not know if I'm going to be okay. You do not know if I got this. And I'm not strong. I was given a crappy card, or hand to deal with. But it's just wild. And I thought the same too. I was healthy. I breastfed. I had kids, like all the things to prevent breast cancer I thought I had done.
Yeah.
I was a pretty healthy eater. I exercised.
Yeah.
I was stressed. Sure. I had 2 little kids and I was working, but I didn't feel like it was anything crazy than every other mom I was around,
Totally. Yeah. I had great blood pressure. My labs were actually good. I don't know if
Mine were normal.
Yeah.
Like great too.
That's something I think important for people to know, because it's your labs from my understanding, so we're not oncologists here. We're just explaining our story. But my understanding is if it's early on, the blood, it hasn't gotten necessarily into the blood to show those changes. So if somebody's getting blood work and they're like, oh, I'm fine. It's like, well, and you still have that gut feeling. I think it's important for people to still, get imaging and in my case, the imaging was missed. And so then I have to ask my doctor to go through the image with me, right? Because if you think about radiologists, they're looking at how many images a day. I mean, AI is going to be helping this in the future, which I think will be helpful because it won't miss stuff like this. And I don't know if this person looked at it in the evening when they were getting ready to leave or whatever it is, but being told it was clear, and then you get somebody else look at it and it's like, it's absolutely a golf ball sized tumor. So it's like this weird, you think you're clear, your blood's normal, and then you get told it's not. And like in your case, like you were saying, yours, you want to explain like how yours was the ultrasound that found it, not...
Yeah, so I had, because I was breastfeeding, they didn't do a mammogram first. They did an ultrasound, which I'm so grateful, because that's what found, detected some tissue that looked off. And then I did the needle biopsy. So I'm glad I got, like you said, it was about best case scenario as far as, but I mean, she wouldn't have done the ultrasound if I hadn't really pushed for it.
Yeah.
So it's like, you have to really like push for this stuff. And I had it in my head, I wasn't leaving that appointment until she ordered it. So I think it's really important that you advocate to get imaging, because I see it all the time on moms groups too. It's like clogged duct and mastitis, and it's like, just use soy lecithin and just do this. And I'm like, no, go get an ultrasound, because there is a crappy population like me who it is going to be breast cancer.
Yeah.
And it was just something as simple as, I keep getting mastitis, or I had a clogged duct. So I always am on there. I'm just like, just go get an ultrasound, just go get some imaging. It's like, and like you said, it can miss. So then I had an MRI and a mammogram after my ultrasound, and those both were negative. So I'm thankful I didn't start with that, right? But it's important to get multiple images and multiple views, because like you said, sometimes things get missed. Maybe somebody interpreted wrong. Maybe it wasn't the right view.
There's like these nuanced things I think that people are unaware of, because you're just like, oh, the imaging was clear. What imaging? When did they do it? Who looked at it? Did you review it with your doctor? I also think that, not everybody has cancer. Right. And so there's like this balance of not over imaging yourself, but also listening to kind of to your intuition. Because I feel like there's 2 things. There's anxiety about it, and then there's intuition. And for me, the way that I would describe it is like, if you have like this subtle underlying kind of like little voice that's like, hey, go get it checked out. Like intuition's more quiet. And then it's like, if you keep having that and you want to just get it checked out, like go get it checked out and like go through the route to do that, versus if we think everything is cancer all the time. Like I have a lot of family members that are constantly thinking like they have some form of cancer because of they tend to lean more towards being a hypochondriacs because of just fear around that. So that's kind of where I came from. And I was kind of a hypochondriac at the time. But it was just like this little subtle thing. And I remember one day I just woke up and was like, I need another opinion. It was like this inner drive, I would say.
I think also like something that's not going away, right? Like a clogged duct should not last 6 to 8 weeks.
Yeah.
Like that's not really necessarily normal. Like sometimes it'll keep coming back but if it's not changing, like I think there's weird signs. Like I said, that weird itch, A lump that's not going away.
I mean, a golf ball tumor.
Yeah, like that's not normal, right? Like I think that, like, sure, do you need to jump on it week 1 of feeling something? Probably not.
Yeah.
But if it's like lingering on, because unfortunately young people tend to always have the most aggressive types of cancer, so it's like you don't necessarily want to delay figuring it out.
Yeah.
You know?
Totally. And I think that it's a balance too. I also think that cancer isn't as deadly as it was like 20, 30 years ago. I mean, it still can be deadly, but when we catch it early, and the way that I was kind of described is that it can be treated almost like a chronic illness too. So say if like you do get a certain stage of cancer and you can manage it, and you know, they kind of keep an eye on it. It's obviously not ideal, but it's not as much of a death sentence as it used to be. It still is for some people, unfortunately. But I think also when you tell people you have cancer, they're like, oh my God, like they immediately assume you're likely going to die or something like that. It's like cancer death. They're like this like immediate. And obviously that is the case and it can turn into that. But there's so many people like ourselves that survive and are 5+ years out. And, so there's a lot there. I also think like for me, there's a little bit of like survivor's guilt sometimes, you know, and like you and I were talking, like hearing your story and you can explain it more, but understanding like your breast reconstruction and you going through chemo too. And I'm like, well, I only did chemo 3 months. Like you went through so much more. And, you know, you can talk to anybody and then, you know, so there's like this weird kind of comparison thing. I think that happens too with cancer survivors.
Yeah. And cancer is just shitty all around, honestly. It's just a bunch of bad decisions you need to put together. And sure, there's worse people in worse positions, better positions. But I think it's just like listening, like we've talked about, you know, instead of saying you're so strong, you got this, like just like let them listen and be there and help and do something.
Totally.
You know, cook, clean, drop off groceries. I don't know. I think there's so many ways we can like support people.
Yeah. So then, the next thing is like, how can people listening support people they love going through it? And like, I love what you're saying. You're like, I hated it when people told me I was strong. Why would you tell anybody that they're strong for something that they didn't choose?
Yes. And it's like it's not a good time. I mean, you just are going through the motions. You're trying to survive and do the things. And then people are like, oh, did you know you could just do this lemonade cleanse and it'll cure your cancer, or do this Mexican herb? And you're like, I'm 35 with 2 kids, or I'm 33. Or like, it's like, that's ridiculous. Like, you have to do what you feel comfortable with, but that unnecessary advice is not helpful when, you know, you're not stoked about poisoning your body with chemo. Like that's not a choice that I think either of us were excited about.
Totally. And especially coming from like a holistic, wanting to be like clean eating and all this stuff. And then so I'd say like what we were just saying is supporting people, oh, you're so strong, or you can do it. And it's like, I don't need cheerleaders.
Yeah.
I don't want that. And I'd say that is probably the biggest complaint that I hear from people that are cancer survivors, are like, people are like cheering me on. Like, you could do it. You're strong. That's not what people want to hear. Like my favorite conversation was with one of my girlfriends. She said, damn, this sucks. Like, and she was just so real and in it with me. She was like, so what's the plan? Like, what are you going to do? You know, can I bring dinner? You know, I think the thing too is when people are like, what can I do? I don't know. I am dealing with 100 other phone calls. Like every hour, I'm getting a phone call from somebody in my family, somebody from the insurance company, somebody from the surgical center, somebody from my doctor's office, somebody from insurance, somebody from the infusion center. Like, I don't have capacity to tell you what to do. And I'm so appreciative of the help, but I cannot. I'm also the first out of most of my friends to get, actually all of my young friends to get cancer. So nobody knew what to do.
Yeah.
So I'm not blamed. They were all super lovely and wonderful, but I'm just saying, like, if we can help and propel this forward, what can we do? And so,
And same, I was the first one. I mean, nobody in my family, I mean, my grandparent, you know, elderly, but nobody young, you know, and nobody in my friend group. But yeah, can I start a GoFundMe are you financially struggling? Can I set you up a GoFundMe? Like, or not even ask, but like people just set me up a GoFundMe. Like, I'm so grateful for that because it really helped us financially. Can I set up a meal train for you? I'm going to have a housekeeper come clean your house. I'm going to have somebody walk your dog, like, and watch your kids. It's like all of a sudden people are trying to help, but I was diagnosed in February, right at COVID. So it was like, everyone's like, oh, I'm going to help you with your kids. And then first day of chemo was the day the world shut down and nobody was there for our kids. And we were like, well, I literally can't take the kids to the infusion center.
Yeah.
Luckily, our daycare lady last minute decided, said she would take our kids. But like that kind of stuff is so helpful.
Yeah.
Because she took my kids, chemo can be like 6 hours. 7. It's like long day.
That's another thing. You didn't get people to sit with you because it was chemo. It's 2020, right?
Because I had my husband as my capper. I got him designated as my helper, but I had to fight for that.
Tell people what a capper is.
Oh yeah, so,
We can talk. I know, but people are not aware of what this is.
So right before I started chemo, that was the day literally the world shut down. I had seen on a Facebook group about cold caps, about saving your hair, because my hair, I think for most people, like the thought of chemo, first thing in my head was like, sure, this toxic chemical, but I don't want to lose my hair. So I purchased these cold caps. You rent them. You have to get dry ice. It's a whole thing. They ship them to you. You have to learn how to use them. It's a negative 30 some degree cap on your head. You wear it for an hour before chemo, during chemo, and then it depends on the type of chemo you do, 3 to 5 hours after chemo.
Oh, I didn't realize that.
So it's a whole ordeal.
Okay.
So I decided to do it because I was like, wigs are expensive. It's a pretty hefty investment. I think when I did it was like $2,200. I did penguin cold caps, and it's a lot of work though. So we watched YouTube videos, and then you have to go get dry ice. So you go before chemo, get a giant thing of dry ice. You have to put all your multiple caps because you change them out every 20, 25 minutes. Mm-hmm. And I show up with this giant cooler, my husband, because he was my capper. And they're like, oh, no visitors are allowed. It just changed this morning, because that's how it was in COVID, right? Everything was changing that morning. Yeah. And I was like, I just invested all this money. I don't want to lose my hair. If you miss capping one chemo session, there's no going back from that.
Really? Okay.
Like you have to do it the whole time. Yeah. So if they were like, well, we have to call management. I was like, okay, go ahead and call management. I'm just going to wait. Like I put up a fight.
Yeah.
And I feel kind of guilty about it because they were trying to protect people, but also like hair matters and your mental health matters. And I was by far the youngest person in there. And I just don't think it's okay they didn't care at all about mental health.
Yeah.
Going to chemo by yourself too.
Especially your first
time. I know. I would have been by myself the whole time.
Yeah.
It's my husband. We're in the same household. Whatever germs I have, he has. Like, this is ridiculous. You can put us they had some private rooms. So that's what they did. They ended up putting us in a private room. But they acted like, I was the biggest pain in the ass.
Of course.
Because I was had this cold cap system, which I was doing. We were doing all the work, but it takes up some space. And I was like, really? Like, I feel like, first of all, you guys didn't even tell me this was an option. You told me I wasn't going to lose my hair. And then when I did research, I was like, oh, I'm going to 100% lose my hair.
Yeah.
So the whole thing was so irritating. But yeah, that was COVID times. But I don't think anyone should have to do that stuff alone. Like, you should be able to have somebody there with you.
Well, there's, oh my gosh, there's so much. It's so interesting how different our experiences were, because first of all, I wasn't able to use a cold cap. I looked into it, but it's only for people with solid tumors, at least back then. I haven't researched it now. And so having Hodgkin's lymphoma, it's a blood cancer, so it's affecting my lymph nodes. And so I couldn't do it. So I didn't even have to look into it. But I would say that I actually had too many visitors. Like, they got to this point, because mine was 2019. Mm-hmm. So it was like July 11th, 2019 is when my first chemo was. And I had so many people that they were like, you need to not have any people. And it was kind of I felt so, I was like, oh my God, I didn't realize I had this many friends.
Aww.
And at the time I was married. So it was my partner's friends, and then his family. And then I want to say my sister was here. I had a friend pop in to visit. They had so...
You're like royalty at your chemo bed.
I felt so cool. I was like, okay, wow, this is crazy. But at the same time, it was super sad. But I think that's a big thing that people don't know about, is asking if, so now it's post-COVID, right? But like, I don't know, it depends on the hospital policies, but asking if they can sit with you during your infusions.
It's huge.
Because it is like, these infusions are anywhere from 6 to 8. The first time can be longer. So that first infusion's longer because they want to slowly infuse you to make sure you're not having like a response, a negative
allergic
response
reaction
to it. And I did. My belly swelled up and it started itching, and I was like, great, of course, naturally. But having somebody come and sit with you. I will say, I heard this and it stuck with me. Be careful about having people bring like your favorite foods.
Oh.
Because you don't want to eat them ever again after.
Oh, that's sad.
Did you experience that?
I wasn't allowed to bring, we weren't allowed to bring any. I mean, like I
bring
said,
anything.
we weren't allowed to really bring anything. It was a weird time. I mean, I'm just so grateful. It really brought my husband and I together, him going. And it was almost like we were like, oh, it's our date day. Like, you know, we did once a week chemo, and it kind of ended up being really good for our relationship, to be honest.
Yeah.
Because we were in that busy household with kids, and it was like this whole chunk of time.
Yeah.
We would go get coffee, we'd go get the dry ice. We had like a little routine. So for us, it was like really good. But yeah, most people during that time just had to do it by themselves. I actually told them too. I was like, okay, no problem. I'm going to take my IV pool and all my crap, and I'll just go down to the parking lot every 20 minutes. That's what I told them.
Yeah.
And they're like, you can't do that. And I was like, well, then you need to let him in to cap my head, because people were trying to do it on their own. And it's, first of all, it's freaking freezing. They're in dry ice. You have all your IV, and people are trying to put on caps, and I don't know. It's just so ridiculous. So yeah, I think my time was a little unique because it was that weird start of COVID time. So hopefully it's better now. I mean, hopefully they don't give you such a hard time.
I do think that there's a lot of gatekeeping and shame in the cancer world too, of like, oh, you have to do this, you have to do this, or, you know, not telling you, hey, there are cold caps. Like, why are we not telling people that? Because we don't want to deal with people doing the cold cap switching.
I don't understand
It's
that.
different when when you start to lose your hair. It is your identity.
And you lost your hair.
I lost my hair.
And I didn't lose any hair.
I lost like 80% of it. And at that point, it's like
What's the
falling out.
point?
I look like that Toy Story toy. Do you know what I'm talking about? This. It's like she has like, or it had like 3 hairs coming out.
That's what happened to me though too.
Yeah, I was like, I'm not going to do that. But yeah, I think that it's important to advocate for yourself, asking your friends or your family members if you'd like to sit with them. You know, you're literally there for like a whole day. And so there's so much there. And so we'd have, meals are super important. So somebody can set up a meal chain and set it out. Like, there's also coming over and just be like, can I do your laundry? Instead of saying, what can I do?
I'm going to do this.
I'm going to do this. Is that okay? And if you live far away, I would say you can give like gift cards to like Uber Eats, or like a lot of friends did that, where they would do that, or like they'd send like a gift with like socks and like ginger chews and stuff to help with that. But I'd say the things that help the most are just ground level, just functioning, just cleaning your house, getting your laundry done, eating, or like some of the hardest tasks.
And dog walking, childcare, like
totally.
all
See, I
that
didn't have
stuff.
kids.
Yeah.
But I will say, you know, you said it brought you and your husband together. Unfortunately, especially in younger couples that have gone through cancer treatment, it actually sometimes, I hate to be like a Debbie Downer here, but I also think it's super important for people to know, because I was warned about this, that it actually can be very straining. And I got divorced soon after. And it was very hard on my partner at the time because he didn't know how to deal with it. I didn't know how to deal with it. And unfortunately, it is a very strong percentage of heterosexual couples, if the female gets sick, it's oftentimes a divorce because the male partner is unaware of how to help. And that's not shitting on men. It's not it. I just think that we need to nip this in the bud. Like, I think oncologists need to, I think I'm pretty sure I even told my oncologist, we need to be having couples going into couple counseling immediately, or some type of support, because there's something that's happening. I don't think that many men are that shitty where they'll just leave.
Yeah.
I think that, and this also happens from, I've heard it, a man getting sick and then the woman leaving and cheating or something like that. Like, so it's not, but you'll see the percentages are extra high.
But it's a lot.
is.
It's a lot on the partner, honestly. I feel
It
for
is.
the caregiver partner too. It's hard on you going through it. I think it's almost harder sometimes on the person trying to help and do all the things and be the good person and be there for you, but still hold
But it
together
breaks
things.
them.
But it can be a whole lot.
It can break them.
It's a lot
And so
mentally.
That's what I'm saying. Like, if we can, what can we do? I mean, I was at a cancer survivors retreat. 9 out of 10 of us were divorced.
Wow. Oh
9
my
out of
God,
10.
that's so sad. Yeah.
It's very high.
I feel like for us, it was harder post cancer.
Yeah.
Because I think during cancer, you're kind of like, okay, we got this. Okay, we're doing this. Then you're like, you're good.
Yeah.
You're good to go. Like, you're cured. And you're like, you feel, and we can get into, all the changes in your body, changes in sexual, function
All
and
the
health
stuff.
and all the things. Like, I think it's kind of like you're in go mode. And then all of a sudden for us, we were like, whoa, like now we have to navigate, like, I've got changes and, it affects your relationship.
Totally.
So I think sometimes that after phase can be just as hard as the during phase.
Totally.
And then all of a sudden everyone was there for you. And then all of a sudden you're like,
They're gone.
You're back to
I'm
being
not
a normal
gone.
person. But you're like,
Yeah.
okay, you're back to the world. And I did that too. And we've talked about this. Like,
Yeah.
I just went back to work and, I'm seeing patients. I was in ortho at that time mostly. And I'm seeing an elbow pain patient. And I'm like, I don't give a shit about your 2 out of 10 elbow pain. And I was finding myself super resentful.
Yeah.
And I was like, this is not me. But I was so irritated. And you'd have like an older person being like, well, you don't get it,
Like, oh, I don't
Yeah.
get it. Okay.
So
Yeah.
I was finding myself getting really snappy with my clients. And I was like, oh my God, this is bad.
Yeah.
And that was when I dove into, I felt like I needed to dive in more pelvic health and complex and chronic pain. Because I feel like these little things were annoying me so much. I just couldn't, I didn't feel like I had it in me to treat an elbow pain anymore.
Totally.
I just felt like I had so much more I needed to offer. And we've talked about this with like health, coaching and, overcoming challenges and manifestation or visualization. I just felt like I kind of started that journey. It's been growing, but I think it's hard to go back into just the real world.
1,000%. Yeah.
And you're supposed to just go back to work and working out and having sex with your partner. Like, it's just like everything's supposed to just go on. And you're like, wow,
Totally.
like that was a whirlwind.
I think it's important that we dive into that. But before, let's kind of circle back of the top things that people can help with to summarize. Instead of telling people they're strong, really sitting with them and having real conversations like, hey, this really stinks. Like, I'm so sorry you're going through this, asking, hey, can I come by and do your laundry? Can I make your meal? Instead of what can I do? Because we're already pre-focused on just getting through the day, figuring out the insurance, figuring out getting to and from appointments. When is my appointment? Because when you're diagnosed, it's like you're in this vortex of like all of this shit you have to do. You can't think outside of here, at least me. And so when somebody's like, oh, I'm like, I don't even want to think about what I'm eating. And so somebody coming in, cooking, cleaning, setting up meal trains, childcare, cleaning, laundry. I think I've probably just said the same things a million times, but you're kind of getting the point in that. And so, and then, diving into the relationship challenges, I think it's important that we get support early on, what that looks like. Maybe we can ask for resources. Some places, like in Austin, there's Flatwater Foundation that provides free therapy for cancer survivors or people going through cancer treatment. So what nonprofits are out there that can help people? Because I think it's so important early on for couples to literally get the skills to help, because I think it can be so hard for the partner because they don't know what to do either, and they can shut down, and it can be a lot for them too. And so, So,
But I agree. There's a lot of organizations, like I said, 2020 was a little funky, but cleaning, there was a cleaning service I used. They came out when you had surgery for 4 times and cleaned your house.
Yeah.
Like all free, which was like really, like I said, the things you don't want to do is clean your house when you're going through all that.
You don't have the energy. And it's funny because you look like, at least when I had friends visit, they were like, oh, you look fine. Let's go here. I'm like, no, I literally, I can't. I need to sit on the couch. Like, I'm not as active as I used to be. But there's a lot of cool resources. There's there's therapies. I know Live Strong has a lot. I want to say like a lot of resources too. There's also a lot of resources post cancer as what, like Not a ton. And there's more now, but when I went through it, we'll dive into that whirlwind kind of shoot back into real life. But there are other things, like I think it's called the first descents. And that's also, have you heard of this? So they do a free trip. They cover your trip for like a week after you're like recovered and feeling better and it's an outdoor activities. And it's free for cancer survivors that had cancer under 40.
There are some by me. I never took advantage of, like, it was a little funky because things weren't quite open.
Well, I was
And then it's like weird to go like 5 years later, right? I actually reached out to one. I know I reached out to a group recently. It's all in LA. So, it's doable for me. It's an hour and a half, 2-hour drive. But I was like, do I deserve kind of that guilt? Like, do I deserve to be there? I have my hair. I don't look like I had cancer anymore. But I never really got to do any of that, any of that
COVID?
support groups. Yeah, it was all virtual support groups, which was great at the time. But, like it's old, all the Facebook groups. And
yeah.
I didn't really get any of, and in person, if it's a lot of older individuals, that's not really doesn't feel like the same phase of life as you're in.
Totally. Like cancer, and not discounting people who have cancer later in life, it's still horrible. But when you've got littles, when your fertility is affected, you are running businesses,
It's a different.
I had just started my business, and so there was it was financial stress. Like you've got all of these different things versus like maybe when you're older and you're retired and you still have the income from maybe your retirement, or you have Social Security and you have Medicare covering those things. But and not discounting the pain they go through, but it's just different life challenges that happen. And yeah, I didn't get to use mine because I was booked for it, and then COVID hit.
Oh shoot!
So I keep a couple of my friends who were diagnosed with cancer recently. We were talking about doing it and going, but maybe you and I.
Yeah, I know. Maybe we should do it. Yeah.
Because I think it was like the cutoff was like it's up to 40 if you've had it, but if you've had it earlier, before 40.
And I'm 40 now, so I'm like at that weird.
Yeah, but you had it when you were 35. So I think they say up to 45, but if you had it between 35, 17 to 40 or something like that. But yeah, there's some of those resources. But I think it's important to jump into what you were saying is like you have all these treatments, right? It's your whole life.
Yeah.
You ring the bell and you're done.
Yeah.
And then
you're supposed to be good.
And you're supposed to be good. And everything's supposed to be great. And you're like,
I'm alive. I'm thankful. Yeah.
And then you're going back into the real world of people complaining about mundane little things. Like you said, you were like building resentment. And for me, it was just more like, how do I function? What do I do? I was also going through a divorce, and then COVID had just hit. Business was not doing well because of COVID. So it was just like so many things. And it was weird because when lockdown happened, it was like, oh, people now know what it feels like to go through cancer treatment. Because I was on lockdown because you have to do those,
You were on lockdown before lockdown, which is super crappy. Yeah.
Well, like you and I were saying, like when you go and you do chemo, sometimes you need this shot in your thigh or wherever they do it to stimulate your bone marrow so you can help build a healthy immune system as your chemo's attacking your body. Because if your blood count's too low, they can't give you chemo. So
we both had the honor of this lovely medication.
It's harder than chemo.
Which we were like, this is so much crappier than chemo because it feels like your whole spine and sacrum are ripping out. I've never experienced such pain. And
I have so much bone marrow right there.
It hurts so, and you're like debilitated on the couch. And I was like, you feel like I'm getting through chemo. This is great. I got this. And then you take that injection and you're like, oh my God, I feel like I got ran over by a freaking train.
So I switched brands. The first time it was like that, I switched brands and it was totally different. But I will say the medical marijuana was such a gift during that time. I know you did it. But for me, I was like, you
need something because you can't function. I mean, they were trying to get me to do that weekly. And I was like, I will do bi-weekly. I will not do that weekly. And then I think what ended up, you have to find a combo if that works for you. I think I ended up doing Zyrtec and something else that worked for me that made it manageable. But that medication, it's no joke.
Yeah. So you go from like having to, well, yours is different because everybody was quarantining anyway.
I know, which is honestly a blessing in disguise. If I had to pick a time to go through cancer, 2020 is a time. Everyone was miserable. Nobody was traveling. I wasn't watching in people in Costa Rica and Hawaii, and like you probably were.
I was.
I know. Versus me, everyone's miserable. And I was like not that worried. I was like had my own stuff going on. So the COVID stuff didn't affect me as much because I was already quarantined and careful and isolated anyway.
It's funny because it's like, I remember like all these people, I remember being in Athleta and I remember overhearing, so I had just been diagnosed. My mom was there with me and the parents feel like my mom was like, it should be me, like that. I can't even imagine the pain that my parents felt just like seeing me go through that. But I remember my mom coming and she was like, I'll buy you like, what do you want from Athleta? I'm like, oh, none of this matters. Like, you're just like, you look at it and like, all this shit doesn't matter.
That's the blessing of cancer. We've talked about
It's such a blessing. I mean, we can get into that more later, but it's like, it's such a blessing. In the moment, it's not.
Yeah.
You don't think of, I mean, I didn't think of it that way. I was pissed. I was angry. I was screaming into pillows. I was punching pillows. I was crying. I was just a fucking mess. And then everybody's calling you, asking you how you're doing. And I'm like, I just can't. I remember throwing my phone and being like, I can't answer the phone. I can't talk to anybody. I was like isolating in a room upstairs and just like, I can't. And I remember overhearing a lady just said, I thought I'd be like, yeah, I'm so frustrated. Like I couldn't fly into Kauai. So in Hawaii. And so I have to go to here and I'm just frustrated with this. And I was like,
those are such small little things.
oh my,
Yeah.
oh, to have that
As your problem. Yeah.
right. But yeah, I was like, oh, I get to finish cancer to go through COVID.
I know. That actually, like I said, if I had to pick anything, I had it at the better time.
You did. I remember thinking, I wish I went it.
Minus if you didn't get diagnosed, because I had an option of getting that ultrasound that next morning or 3 months out. If I had chosen the 3 months out, I might not be here. Who knows?
Well, I also had people
So-
that went through it during, depends on the state you're in too. I mean, you're in California, so it's pretty strict, but like some people couldn't even get their chemo because of there was just so much stuff with like the chain, the supply chain, delaying things, shutdowns, people getting COVID, so understaffing. So like some people that went through
It
it,
was a lot of complexity. Yeah.
it might have been easier from like, oh, everybody else is shut down, but they weren't able to get access to the care.
Or get diagnosed or
Yeah.
get them stuff they needed.
Totally.
Yeah. It's complex for sure.
But yeah, so jumping into like
After.
post, right?
Aftermath.
The aftermath. It's weird. Like it's this weird, I don't know. How would you describe it?
Well, you're supposed to be so happy and thankful and grateful that you're alive and you're good to go, and you're terrified cancer is going to come. I know for me, I was already like kind of, very clean ingredients and products, but I went kind of insane. I mean, I got rid of all my shampoo, conditioner, any product I was using. I remember bringing it to my sister and I was like, do you want any of this? It was like nice stuff. And I already like all the glass, like I went a little crazy with it.
I think most people do. I did too.
Yeah.
And then I was like, oh, I can't eat this. I can't eat that.
Yes.
But I was already doing that before
Yeah.
when I got it. So I had severe crippling anxiety.
Oh.
Like, I don't know what everything I thought was cancer again.
Yeah. I was worried about my kids. My daughter was having a lot of stomach GI stuff at that time, and I was like, she needs an ultrasound. I mean, I was feeling, you feel panicked about your loved ones having something you're missing too.
Totally.
So I don't know. It's a really tricky time, and I don't feel like they really prep you enough for it. And I remember my neighbor who had Hodgkin's. He unfortunately passed away now, but he was like, Lori, you're going to need therapy after all this. And I remember him telling me that, and I didn't do it. And I probably should have, because I do think it's a lot to go through. And he had it at 19, like really young. But I remember him being like, you are going to need, you don't think you need it, but you need
You don't think you need, I've been in it. I'm not in it right now. As I heard somebody say the other day, one of the girls was saying she uses therapy topically now, like as needed, to go through stuff. But I feel like that's where I'm at right now with some things, but I went immediately because
which I think is the right thing to do. And I didn't. I just kind of acted like I was, working. I was a mom. I was back to life. Everything's fine.
Yeah.
But I don't think it really is fine.
No, the body keeps the score.
It's not really fine.
Well, so for me, I think like what helped my anxiety about it returning was becoming okay with death. Like, and that is a weird thing in our culture in the US, and how we don't feel comfortable talking about death and sickness and illness. And it was interesting because like what calmed my anxiety, well, it was a few things. It was, how do I become closer and more comfortable with death? And I started thinking like, well, what do I think death is? And I immediately go, oh, you're going to burn in hell for eternity if you're in mortal sin. Because I grew up in a very Catholic world. And I was like, well, what are my beliefs? Do I truly believe that an all-loving universe, something greater than me, is that way? And I had to go down my own journey and be like, no, I believe it's infinite love and kindness. And we have, my perspective is different, as maybe this lifetime is, this is something that I needed to go through to learn for whatever reason.
Which is kind of a blessing, right? Because it pushed you into that earlier.
Yeah. But then the other piece that I would say is Western medicine saved my life. Eastern medicine saved my quality of life. Because when you found out you had breast cancer, like, did anybody tell you why it happened?
Everyone's like, you had childhood trauma, you're stressed out, you have genetics. And I had big genetic panels and it wasn't genetically linked as far as we know. That's, I think, the biggest misconception. It's like, everyone's like, oh, well, you have the BRCA gene. I mean, that's only like 10% of breast cancers are actually linked to something we know genetically. Sure, there could be something else. But yeah, I mean, I didn't I went back to like college. Sure, I drank kind of heavy in college. I lived in a dorm. Maybe it was something environmental.
Everybody did.
I know, but you go through such a crazy, you go through that guilt of like, what did I do wrong? Like, there's a lot of farmland around where I live, it's a lot of pesticides, but it doesn't, and to me, sure, a lot of that could combo, but I think cancer also just doesn't really give a shit. It's just spinning. I mean, there's kids and babies. I mean, they haven't done anything wrong per se, it's
Totally.
just doesn't quite make sense.
Well, that's why I kind of have to look at it from a spiritual realm. Like the way I look at it is we're all here, like we have souls that are eternal. And then I believe that we're here on this earth to live out some type of mission or lifetime service or whatever it may be. And we all have different things. And it's whether it's based on, what was cancer supposed to teach me? And this is my own opinion of it. So I don't like push it on anybody else. It's just like, for me, it was to wake me the fuck up.
And same for me. It changed my life and kind of a lot of positives too. Both of us are super passionate in our businesses.
Yeah.
We want to live life to the fullest.
Yeah.
We are rejecting this hustle culture. I mean, it changed me. I started making time for it was like, I'm going to work out. I'm going to do this. I'm going to be a little selfish and make time for myself. I think a lot of people, especially moms, are horrible at that.
It's like women in general. On being a mom. Yeah.
They don't make time for themselves. It's not healthy. Like, and it made me a little bit more selfish. Like, I'll tell my husband, like, I'm going to go surf this morning instead of him just going to surf and me staying with the kids. Now we both find a way to go do that. And it's like,
it's not selfish though.
Yeah.
That's what I'm saying. Like, you're saying it's selfish, but that's not.
But that's what I felt because I had never, I felt like I wasn't really doing that.
Yeah.
But now I'm like, no, it's vital. It's like, you need the health to then treat. First of all, we have a lot of, when you treat clients, it's like, it's emotionally draining. Like, you need to be in a good place yourself and good energy to treat people.
You have to have a positive energy in order, because I think if you're not grounded in your energy, you affect the patients in front of you.
Yeah.
And so, I think that that's why we got along, I think, immediately, because we both own businesses. We're not into hustle culture. We're growing our businesses at a steady pace that's reasonable and
maybe not as fast as others.
It's not as fast as other people, but also I see the other side where people grow really fast. Not even in PD, but just in any other industry. And then they're stressed out, and making all this money, not traveling, not having supportive relationships. And just like, there's a whole panel of wealth. Wealth is time. Wealth is relationships. Wealth is your health. Wealth is money. It can be money too. And then yeah, like, and then your inner world too, like your mental health and all of that. And so if any of those buckets are empty, we focus on capitalism. Like, don't get me wrong, I love making money, but it's like money is here, everything else is down here. And I think that's making us unhappy and sick. And so that's why I think it's hard being young with cancer, because you have this mindset, at least I do, of like an 80-year-old. Like every decision I make now is like, would I be proud of this on my deathbed? Because I
Kind of
remember
true.
looking
Yeah.
out the window, my first chemo, I say this all the time, is just remember being like, why the hell did I live for everybody else and not myself? And so it's so for me, it's like crystal clear. Like, no, I'm not going to make that business decision, even though it would make me so much money, but I'd be miserable. Right. And so it
Which
can be a
aren't you
little-
grateful of? I mean, I'm so grateful I found that. I mean, I wish I would have found that out in my 20s, or, you know.
I wish I would have always had
I
it.
wish I try to teach my kids some of that now. I think we should learn that in childhood, but how, like, I don't think I would have gotten to where I am now, the amount of personal growth. Do you think you would have if you hadn't gone?
way.
Yeah.
I was dead
Because it's
inside.
a wake up call. It's like you know, little things and like little annoyances in life. Sure, it still annoys me, but I don't take it nearly as serious. Like,
1000%.
yeah.
But then it can get a little lonely because like people our age are hustling, or getting caught up in being just like a mom. I mean, like everything's about the kids and like everything's about work and ignore myself. And I'm like, I don't understand that. But I used to be that. I didn't have kids. But that's the culture for women.
And that's, like you said, why we clicked, because we both got that.
It's like, I don't want to hustle all
Yeah.
the time.
And moms too, it's like you need to make time for yourself. Like, it's not healthy for anyone when you just feel like your only focus is your children, or your job, or, you know, any one focus, laser focus. And I worked with a lot of really elite clientele when I worked in San Francisco, and like you said, money doesn't always bring the happiness, but it can too. Like, it can,
if you do the work and
Yeah.
then the money, it's like woof.
it can bring a lot of
Yeah.
amazing, you can do a lot of amazing things in the world with money.
Yeah.
But it also, you don't want to wreck your health to get that money, and then you are just miserable.
Well, what I see, you've probably seen this, is I've seen people make so much money, and by the time they make all their money, like their health has gone to shit.
Yes.
So then they take all that money to work on their health versus like if it was more at a sustainable pace to make that kind of money, we might not be in this situation. But it's not blaming people, it's our culture, and this needs to shift. But this kind of going into this now about our changes post chemo is both of us have agreed that we believe we're in early perimenopause because of this, and then we're gaslit saying that we're too young.
Last week, my oncologist, I said, you know, I've gained weight since I turned 40. I'm just noticing changes in my body. I mean, I noticed changes immediately after chemo and vulvar health and clitoral stimulation, you know, ability to have an orgasm. Like,
Yeah.
she completely was like, you're way too young for that.
No.
Chemo does not put you in, you are not going to have early perimenopause and menopause because of chemo. I'm like,
How can people say that?
I know, like, and I had to call, I was like, Mary, I don't understand. Like, how does that any logical sense? You've destroyed my ovaries.
Yeah.
I can see changes. Like, you go into menopause for, you know, 4 months, 5, some people don't ever come out of it. I mean, I'm grateful I got my cycle back, but I'm like, it's never been normal since I got my period back. And my oncologist is like, well, you got your period back. And I was like, that doesn't mean anything. It's not been 28. It's not normal like it used to be.
That's not even the definition of perimenopause. And it's like any of these changes, even if it's not in the blood work, it shows, and we're in this age range and we've had chemotherapy. I think like for me, it was interesting. It was like, I lost my period. I couldn't even feel my clitoris. Like, it was like, is it ever coming back? Sex was weird because you're just like, your partner's like, are you okay? Like, this is like, you look like a patient, you know, you're like, I'm bald. I got a chemo port. Like, that's not like,
It's not sexy.
you're not like mad. This is like ravishing, like just raging, wonderful sex. You're just like, why are we like, should I even be having sex? Like, do we even want to? Like, what's going on? And it's just the weirdest. And you don't feel sexy at all.
I
You're
had
just
my
like,
hair, but you know, you have no eyebrows, you have no eyelashes, you have no, I mean, the pubic hair gone and leg hair was lovely. But yeah, having surgery, no breast sensation, fake boobs. I had expanders, which felt like armor. I mean, it's not sexy, and it changes it changes things. And nobody preps you really for that. And it's not like it would change your decisions necessarily, but it would be nice to have a little acknowledgement that you're not crazy. She made me feel like I was crazy last week.
No, you're not. And I've
Like-
actually had that where I'm like, I gained, same thing. I randomly had gained like 30 pounds. My blood sugar was going wild. My cholesterol was insane. My blood pressure went up. It's normally 110 over 70. It went up to like 140 over 90.
But these are all things that can happen in perimenopause.
Yeah. But it was like, and then, so that was kind of when I started getting so passionate about teaching people about perimenopause, because my earliest sign was the weight gain. Then it was like severe acne. Then the periods were
So lovely.
horrible. Yeah, the cystic acne on my back and face. I was like, oh, this is hot. Like, didn't know I'd still have this shit when I'm like in my late 30s. And it wasn't until like the last year I was like, oh my God, I've been in perimenopause this whole time. And I had been gaslit by being like, you're too young. But I'm like, I already have history of endometriosis. And so sometimes when people have endometriosis, like your ovaries can be more affected from that depending on where your endometriosis is. And so you might see symptoms sooner. And I fit into that. Like I literally fit into like every category, you know. I was like, oh great. Like I'm this, whatever. And so that's what made me so passionate is like everybody was saying hormones. But like, I wasn't ready to get on hormones because I had just gone through chemo. And even though it's not breast cancer, it was just this thing of like, let me learn my body. What is it trying to tell me? And that's why I'm so passionate about like, if people want to take hormones, great. But even when you take hormones, there's still things you need to do to help understand your body. And some of the biggest things for me is like understanding blood sugar. Like I was, you know, you and I.
She's been educating me about it, and I'm so stoked. I ordered my monitor. I'm going to start next week. I'm really excited because nobody's really, I mean, I'd heard it, but it's just like, stop eating this and that and this. And I'm like, I already eat healthy. Like, and I didn't change anything.
Same.
Like nothing. I work out a lot. If anything, I think I'm managing my stress better. I've done a ton of personal growth. Like, if anything, I think I'm doing things better than I used to, but I still gain 15.
Chill.
But if you gain 15 pounds out of nowhere, you're kind of like, okay. Yeah. But I see it, and it's not even just cancer survivors. I mean, we've seen, patients that have hysterectomies in their 30s from fibroids. I mean, there's so many people in this category.
With still having the ovaries, too.
Yes. And my friend who had a dermoid and lost her ovary, she still has one ovary, but are you going to tell me it doesn't affect anything when you have big things like that? Because she had the same experience. She gained 15 pounds. We were talking about it. And it's like there's changes happening. And it can happen early.
Totally.
It doesn't have to happen at 45, 46, 50.
Well, the reason, the glucose is super important, but it's one of the most foundational like things in perimenopause is that's like the weight gain issue is a lot of times is from that. And so basically like your liver needs to break down your estrogen. So in this case, it's estradiol. That's the type of estrogen that we are slowly reducing with perimenopause. And so the liver needs to break that down. So then it's secreted into, they call them metabolites. And then those metabolites are broken down in 3 different ways. And then it's excreted into our bowels. So we poop it out. But sometimes if our poop is backed up, we can get those metabolites that kind of linger a little bit longer. We get excess estrogen symptoms, or maybe the body starts pumping out extra estrogen because it senses that it's down. So a lot of perimenopause symptoms are actually like a high fluctuation and then a crash. Most times we think, oh, it's just declining. It's like, no, it shoots up and comes down. So an estrogen, estradiol or estrogen, so I'll just say estrogen just to make it easier, but basically like estrogen supports insulin. And so when that starts declining, it causes us to have more insulin resistance. So eating things that we would normally eat, even though it's considered healthy, but it's spiking our blood sugar, our insulin our body's not as responsive to that insulin. So we develop more blood sugar issues. That's why we get belly fat, because then the fat loves to stay there when we have more glucose moving around in our bloodstream. And so on top of that, the liver processes sugar. So now we're processing estrogen plus that sugar, right? So it can get overloaded. And the way I describe it is like, it's like the lines at Costco on a holiday weekend.
So what can we do to support our liver during this time? And glucose, like understanding your blood sugar is going to be super important, even though it looks normal. And like you were like wearing the glucose monitor was super important for me because I started realizing if I didn't sleep well, it spiked easier. My blood sugar was higher if I had more than 1 cup of coffee. And the other thing was my inhaler at the time. And so the biggest impact that I had made on my blood sugar is decreasing my caffeine intake, like substantially, because we think it's just caffeine, but it can do that. So I'm interested to see.
Yeah, I'm super excited to see where my sensitivities are or what is triggering, because you can tell things change. And I think the advice of just, take these, like I was trying, you start getting targeted on Facebook with all these weird supplements for menopause, and you can lose 5 pounds and this and that, but you're not really solving the issue, the root issue, right? And I know we're both
overloading your liver with supplements.
Yeah. So we're both passionate in our businesses too on like we need to figure out the root of the issue for our clients. It's the same thing for anyone, right? Like I'm like, oh, okay. If blood sugar, I've already known I've always been sensitive to blood sugar. I'm sure we all are in certain ways, but
Especially more in perimenopause.
yeah. So I'm excited to see what it tells me.
Well, and it's like, and then there's other brands that will help you understand why your blood sugar is spiking and crashing. But I think you have a basic understanding of it. So if anybody else doesn't, there's different companies that will help guide you, or you can work with a dietitian or nutritionist. But I think it's important for us to kind of see those spikes and crashes, but just observing it as a third party and not shaming yourself with it. But from like a PT perspective, we can help with helping people understand how to strength train, because the more we can get that muscle, the muscle loves that glucose. It wants it. And so that's another big reason too. We're talking about build strength to help with build with strong bones, but I'm like, it will help our blood sugar as well.
Yeah, but that's what we both have become really passionate in the perimenopause community, because we're kind of headed there, but also
We're in there.
We're in there, but also we feel as PTs, we have a lot we could help with as well. And it doesn't have to just be HRT and just Western medical management, acupuncture. Like there's so many other tools, but we both feel we have a lot we could offer as well.
Totally. And it's like this, like, so constipation. So if somebody's constipated, we need to get people to poop, because otherwise you can kind of get a buildup of some of that estrogen. And then that's when you can kind of get these, crazy fluctuating symptoms of like hot flashes and stuff like that. So if you're not pooping, like visceral mobility, like you and I were working on each other the other day on helping improve the gut, diaphragm mobility. Like what are some other things that you use for constipation?
Well, and she was doing fascial work on my scars, and I've had a lot of tightness just since my double mastectomy. And like fascia changes when we go into this stage of life. So it's even more important to keep mobility, lymphatic flow, and help aid our body in that way. And we are really good at that stuff as PTs.
Well, I don't think we're thinking of HRT, but I'm like, no. Like we can do a lot more, like fascial mobility, right? So it's like that first layer of fascia, that superficial layer between the skin, you've got fat, and then you've got fascia, that's superficial layer, and you've got your skin ligaments that connect to it. Most of our lymphatic system flows through there. So when our, like you were saying, when the fascia changes, so when estrogen decreases, it becomes like type 1 collagen, so it's thicker. So that tissue, that highway, the fascia is the highway of the lymphatic system. So if you're impaired with that, now you can get brain fog, you can get swelling, you can kind of get all these symptoms of perimenopause that we think might be this, from decrease in estrogen, but what if it's actually impaired lymphatic flow? So maybe they're on the hormones, but we're not addressing the fascial mobility. We've got all these backed up highways, and we're wondering why we feel like shit.
And we've both seen it where patients tried HRT and they just didn't tolerate it. Like, what do we do with all those people?
It's a lot of people.
It's a lot of people. And I've seen huge gains in just, doing visceral therapy, fascial work, like you said, strengthening, working on, there's a lot we can offer, I think.
And the nervous system too, like helping people understand their HRV, so their heart rate variability. So much of heart rate variability, it's like a huge, huge help for measuring stress. But like, so many PTs are unaware of like actually what HRV is and how to use it as a tool. And I actually just made a PDF to kind of help people understand it. But so much of it has been focused on athletes and like physical changes and sleep. But the piece that we're not looking at with HRV is emotional health. And so as women, especially going through perimenopause makes you not tolerate bullshit. But because your estrogen's declining, you don't have the capacity for stuff that you used to put up with anymore. Now, but during this time though, like I've even made a little list like of things like if your HRV dropped, right? So we want higher HRV because that means we're getting more variability between the bigger spike, like the quicker speeds of the heart rate. So if we're stressed, it goes fast and then it will go slow. So when it transitions, that happens a lot throughout the day, we're getting higher variability. So that's a good thing because it's coming back to a baseline. But things like we were just saying, like, are we taking time for ourselves? Am I doing things I don't want to do because I'm worried somebody's going to be mad? Did I say yes when I wanted to say no? Did I take on something that I didn't have capacity for? Like, these are things as women, like, can even just the way we think can transform how we feel during perimenopause.
I believe it. Yeah.
Well, even
And
just
it's
like yesterday, you and I getting all worked up about our businesses.
Yeah.
And then it was like, okay, so we got worked up. We were like, oh, what was like, and we both like came down this morning. You were meditating and journaling. I went out on the deck and I was like, I need to ground myself.
Yeah.
I can't.
We took that a little too far, but then we need to bring ourselves back and be like, hey, everything's okay.
We're fine.
But this is what happens a lot in business. I think it happens in a lot of aspects of life, but we need to learn to bring ourselves back. Like, you can be pissed, you can grieve, you can be frustrated, you can be stressed, but you can't just stay in that.
Yeah, you gotta. And the thing I get annoyed with is in this wellness culture is like, oh, let's always be in a rest and digest. And I'm like, if you are living fully presently in this world and are actively in it, it is impossible because you can almost get in a car accident or like you almost get in a fender bender, your heart rate's going to go up because you're scared or whatever, right? Or maybe you see something and you get excited, it comes up and then it comes down, and cortisol gets a bad rep. Cortisol is not a bad thing. It helps us stay awake. It helps us function. It's when we stay in that.
We just can't stay in that chronically. And a lot of people, I'm sure you see it too, like, especially with chronic pain. I mean, it sucks. Like, it does suck. Like, it's really shitty. It's not fair, but it doesn't help to just stay in this negative spiral of like, this and that and this and now I can't do this and now this, and I don't know. I've been trying to incorporate some of the stuff I've learned with clients, and I'm working on it, but I do think it's so important because we can't just treat like a PT and ignore all these other aspects.
Well, the APTA actually just opened up our I don't know if you saw that recently, our scope of practice.
Oh, really?
To include more
I've
mental
just always
health.
done it, I think.
I mean, it's literally you can't be treating somebody and not understand like what they're going through, And no, exactly. I think it's important to understand what our triggers are, how to bring ourselves down. That's why I get frustrated with like the whole let's just do breath work and nervous system regulation. But I'm like, we can do those things. Yes, those are tools. Those are not solutions. The deeper thing is, why are those things coming up? Where did I learn this? Right? And using neuroplasticity, like retraining your brain. When you're in trauma, like am working through and have worked through a lot of complex PTSD issues, is like you go black and white when you're in that. There's no gray area. So I try to get people to be like, hey, well, what also could be true, right? Because when we're in fight or flight, we want to go to protect. So like our whole body, it doesn't know a difference between being chased by a bear or, telling us that we're safe. It just knows one or the other. And so we have to show our body that it's safe. But if we're constantly in this negative loop in our thoughts, like, oh my God, should I not eat this piece of cupcake because this and this? And then you start obsessing about the cupcake. And at that point, just eat it. Just eat it, but maybe you don't eat it every day or things like that. Or maybe we don't sit in shame for a while, or maybe we call a friend when we're feeling like we're that, like you and I were like helping pull each other out of it, and it's staying in these little loops. And I think so much of it is our culture is men are, if we're talking about from like a heterosexual sense, it's like they make the money and like that's their value. And then women have the babies and like take care of everybody. And like this is breaking our culture because
a lot of those women are working full time and taking care of everything, and the men have a lot of stress on themselves, but it's just this like,
well, the women are taking on all of it, but then the
emotional.
men have been told, don't have emotions, don't
Yes.
cry, hold it in. And so now they're all having their own crisis, their own.
I think a lot of men are
perimenopause.
having their own crisis.
They have their own perimenopause they're going through.
Yeah.
Like testosterone's declining. Like they're going through their stuff. And so, and then the women's movement, I think, is getting angry at them for everything that they've done. And then it's like shoving them down more. And I'm like, this is not the answer. Like, love is the answer.
Yeah. And I do think it's important that, like, you know, working with a therapist, working with acupuncture, like there's so many amazing people out there. It's not just one tool.
Totally.
It could be a whole team of people helping different people in different ways. I don't think it needs to be one person or one solution. Like everyone always wants that quick fix. Like give me my progesterone and my estrogen. And that's amazing. I've seen people do amazing with HRT. Neither of us, we both believe in it.
Yeah.
But it's just thinking a little bit more outside of the box in other ways.
Well, if you're on HRT and you know you're taking it and it's going well, but you haven't addressed why you run around with your head cut off all the time, it's not going to be as effective in my, like, from what I've seen, right? I'm not giving any studies on that. I'm just seeing from my clinical experience, the people that do really well with it. Also, I mean, currently I'm not tolerating progesterone, so I'm having to do this in the way of blood sugar regulation, nervous system regulation, mindfulness, exercise, strength training, like really focusing.
And you tried it and you gave it a good solid shot in different ways.
It didn't work. But the other piece that's been helping my nervous system the most is just trusting that there's something greater than us looking out for me. If something doesn't work out in my life, another door is going to open.
Yeah.
And I get out of that phase when I'm not grounded, but so much of it is an invitation to understand our bodies and like what our bodies are asking for. And if we can't sit with that, it's really hard to even know what it's asking for, even if you take HRT. So thank you for joining me on this. It was
on
really
this lovely
wonderful.
couch with our beautiful view.
You should see our tripod right now. It's on top of a Berkey and 5 books and a bottle of honey holding up the phone because I didn't bring a tripod. But how can people contact you if they want to learn more about you?
Yeah, so I'm on social media at Dynamic Flow Physical Therapy. Like I said, this is an area I'm really diving in as well. And so I'd love to connect. And I follow Mary and all her knowledge, and I'm excited for the things you're going to bring out, whichever direction it goes.
Yeah, well, I'm excited that you're on this journey with me, and I'm so grateful that we met. So
Yes, thanks for having me.
Thank you so much for listening to my podcast. It would be a huge help if you could subscribe and rate the podcast. It helps us reach more people and make a bigger impact. I would also love it if you could join my email list, which is linked in the caption, for podcast updates, upcoming offers, and events. You can also find me on TikTok, YouTube, and Instagram at drmarypt. Thanks again.